this is our very nice patient who came in to see me with this recurrent pain syndrome in his right eye. And we had to figure out what was going on because his cornea looked fine, everything looked fine, but he felt like there was something in it constantly. His eye was watering. And so I have this instrument that I've developed with a technique to look for something called a corneal erosion. And so we detected that he had an erosion, and we did something called micropuncture, which is using a small thin needle to stabilize the area that's blistered on his cornea. And so I just would like him to share, what kind of symptoms he was having, how the procedure went, and how he's doing now.
June the 15th, 2019, I came down with shingles. 10 days later, that was better, but it settled in my right eye. And I've suffered with it almost 2 years, will be 2 years this June. And after Dr. Kim did what he did, it was better. My eye didn't weep as much. I was able to sleep better at night. The pain was down, and I'm not healed, but I'm a lot better, and I feel like I'll continue getting better.
Great. So I'm glad to hear that. This particular problem you have is very frustrating, and it tends to be stubborn. So we try to cure the problem by doing the procedures, but of course, you can have dry eye issues and things like that. So like you said, it's going to be a continual thing because dry eye never goes away, and it does require treatments. And you did have this, herpes, shingles infection, which can cause long-term problems. But I am glad what we did has helped you. And again, this blister of the eye called the recurrent erosion is something that's not really, it's underreported among doctors, in my opinion. So patients who are told, oh, you have dry eye, just keep on doing the drops, unless you check the cornea with a special technique, it's very easy to miss. And so I'm glad you're doing better. Thank you for sharing your story.
Thank you, Dr. Kim.